This was a multi-hundred patient. It was selected based on PD-L1 expression and using their assay, which looks at both tumor cells as well as immune cells, with a minimum of 5% expression of one or the other to even go on the trial, and then broken it out for the higher expressors, so at least 50% on the tumor cell or 10% on the immune cells as their TC3 or IC3. So when we looked across different cohorts, there were patients who were untreated, first line, second line, as well as third line and plus. And in all of those, the response rates are around 20%, higher for those who are TC3 or IC3. There it's closer to 30%. This was not a comparative trial, it wasn't a randomized trial, so we can't really look to say, oh, it was better than or worse than anything other than historical controls. If you look at historical controls for second and third line, clearly those numbers were better than what you would expect to see. For first line, we can debate that, but it does support going into the trials that are randomized that are happening right now. So there's the Empower 110 trial, which is a randomized trial in selected patients looking at atezolizumab versus first-line chemo. And then the OAK trial was the randomized phase 3 trial in second line comparing to docetaxel, and that was in unselected patients. And we got the press release from that showing it was positive, expecting to see more data in the near term. What I presented today on the BIRCH trial, though, was some longer-term follow-up. So we had over 12-month median survival and outcomes and follow-up on these patients. So that was a big update from when it was initially presented in 2015. And what we were able to show was that in the first-line cohort, in all comers who were, TC2/3 at least, they had a median survival of over 20 months. For those that were even more selected, the TC3, IC3, that still hasn't been reached. So it's going to be probably in excess of that. And if you look at the second and third line cohorts, they're in the 15 to 17 month range. Again, a little bit better with the TC3, IC3 than the TC2/3, but pretty similar.